The meeting will come to order. Clerk, call the roll. Clerk will close the roll.
Madam Chair, you have a quorum.
Thank you. We have a committee that has quite a number of bills that will take a little bit of time to get started. But I would request that as your bills are heard, that you could please exit the room and watch from another monitor, because we have people who need to come in to have their bills heard. And I really, really appreciate your cooperation. I want to start by indicating that Senate bills that need to be referred, starting on page 1, Senate Bill 376 will be referred to the Committee on Labor. Prescription Drug Affordability Board established, and that's Senator Peterson's bill. And Senator Peterson, I talked to you about that yesterday? Okay, all in favor of the bill being re-referred to Committee on Commerce and Labor, let it be known by voting aye on the voting board. Nays have the same right. Clerk, close the roll.
Ayes 12, no zero.
Ayes 12, no zero. The bill is referred to the Committee on Commerce and Labor. Second bill, Senator McClellan's bill, and that is the Literary Fund Loans Application Process Bill, to be re-referred to Senate Committee on Finance. All in favor of the bill being referred to the Senate Committee on Finance and Appropriations, please let it be known by voting on the electronic voting board. Clerk will close the roll.
Ayes 12, no zero.
Ayes 12, no zero. The bill is referred. Third bill, Senate Bill 595, is to be re-referred to the Committee on Commerce and Labor. That's Senator Pillion's bill on the grant, yes, the training grant program. All in favor of the bill being re-referred, please let it be known on the voting board. Ayes. Clerk will close the roll.
Ayes 12, no zero.
Ayes 12, no zero. The bill is referred. And the fourth bill to be referred is Senate Bill 621, Senator Donovan's bill, and that's the retail sale of cannabis products by certain pharmaceutical processors. And so all in favor of the bill being referred to Rehabilitation and Social Services, please designate it by voting on the voting board. Clerk will close the roll.
Ayes 12, no zero.
Ayes 12, no zero. The bill is re-referred to the Committee on Rehabilitation and Social Services. First bill up on our docket this morning is Senate Bill 73. These are the bills before the committee. The first bill is Senator Chase, prescriptions for hydroxychloroquine for treatment of COVID-19.
Thank you, Madam Chairman and members of the committee. This bill prohibits this is Senate Bill 73, and what this bill does is it provides that licensed healthcare providers with prescriptive authority may prescribe, administer, or dispense hydroxychloroquine and ivermectin to a patient with a clinical diagnosis of COVID-19. The bill prohibits the Board of Medicine from initiating a disciplinary action against a licensed healthcare provider solely for prescribing, administering, or dispensing hydroxychloroquine or ivermectin to a patient with a clinical diagnosis of COVID-19, provided such clinical diagnosis and treatment has been documented in the patient's medical record by such licensed healthcare provider. At this particular moment, I'm going to ask the folks who are supporting this bill just to briefly stand, and they're going to speak in support at the end. But if you guys want to stand up, all of you who are in this room in support of this bill that have come. This bill today is about a patient's right to life. A patient has a right to life and should not be prohibited from life-saving or potential life-saving medication by a hospital, a pharmacy, or other administrative agency. Patients should be able to make decisions about their care and treatment in conjunction with the knowledge and expertise of their treating physician. And we have two doctors who will be present today, Dr. Sheila Fury, Dr. Paul Merrick, who have treated a number of patients successfully, including my own aide right now, senior aide. So, but no hospital administrative body or pharmacist should interfere with the practice of life-preserving interventions. Today, we're going to talk about off-label use of prescription medications that has been a hallmark of medicine for decades and has been approved and endorsed in the practice of medicine until COVID-19. Therefore, physicians should continue to allow to prescribe medications based upon their training and expertise to provide treatment to those exposed to COVID-19 and those diagnosed with COVID-19. Early prevention and the treatment of COVID-19 is the key to sustaining a healthy population and preventing hospitalization and reducing the cost of health care. The treatment strategies must include the use of off-label medication, and those should include but not be limited to ivermectin, hydroxychloroquine, vitamin C, vitamin D, melatonin, fluvoxamine, spironolactone, and other medications or supplements that may reduce the morbidity and mortality of patients with COVID. Very briefly, I'm going to talk about the fiscal impact to society. The fiscal impact of this legislation will save the Commonwealth of Virginia millions of dollars. It will reduce hospitalizations, it will decrease the length of hospitalizations, and it will reduce the injury and disability from COVID-19. It will decrease absence from work. It will reduce the impact on the mental health system because of families suffering from anxiety and depression because they feel trapped without life-preserving treatment. And we're going to be talking a little bit today, some of our testimonies today of studies that show how it works. We have over 80 studies that document the effectiveness of ivermectin and hydroxychloroquine. Since the start of the pandemic, both observational and randomized studies have evaluated ivermectin as a treatment for and prophylactic against COVID-19 infection. A review by the Frontline COVID-19 Critical Care Alliance summarized findings from 27 studies on the effects of ivermectin for the prevention and treatment of COVID-19 infection, including that ivermectin demonstrates a strong signal of therapeutic efficacy against COVID-19. Another recent review found that ivermectin reduced deaths by 75%. Despite these findings, the National Institutes of Health in the United States recently stated that there are insufficient data to recommend either for or against the use of ivermectin for the treatment of COVID-19, and the World Health Organization also has different opinions upon it. So there's not complete agreement. But what I want to talk to you today is about Virginia as a right to try state. And this was a bill that Governor Terry McAuliffe signed into law on March the 25th of 2015, and it was House Bill 1750. And this body unanimously passed the right to try bill that making Virginia the 11th state in the country to try right to try. This bill was sponsored by State Delegate Margaret Ransone and was supported by the Goldwater Institute. And if you remember correctly, remember about Josh Hardy. He was a child that was facing life-threatening illnesses from an infection, and he didn't respond to any of the treatments on the market. And so they expanded the ability of our state. You have other states that have the right to try, like Arizona, Arkansas, Colorado, Indiana, and others. The FDA has a process that allows individual patients to ask permission to access investigational medicines, but fewer than 1,000 people a year receive help. Others die while waiting on their approval. The FDA recently announced plans to shorten the application form. Right to try is limited to patients with currently a terminal illness that have exhausted all conventional treatments and cannot enroll in a clinical trial. We have many, many examples, but I really want to, I know you all have a full docket today, so what I will do is cut to the chase here, because I really would like to give my doctors and supporters an opportunity of this bill to speak, and then I will finish up with any closing document if that's okay.
Senator
Mr. Chairman.
Chase, I would like very much if you were to organize your speakers because each side will have 5 minutes. And at the end of the testimony for each side, I will turn off the mic. So you may want to select who you have to come up to speak because they're going to be within that 5-minute time frame.
Okay, very good. All right, so if my folks want to come up who are in support of the bill, and we'll start off with Dr. Merrick, who is flown in here from New Hampshire. He is a doctor with Frontline Doctors. And what I will do before they come up is I would like to properly introduce some of my speakers today. Dr. Merrick was a professor of medicine who served as chair of the Division of Pulmonary and Critical Care Medicine right here in Virginia at Eastern Virginia Medical School in Norfolk, Virginia, and as a critical care doctor at Centera Norfolk General Hospital. His research interests include sepsis and tissue oxygenation. Dr. Merrick, who is also a critical care doctor at Centera Norfolk, is in the midst of a legal battle over the use of ivermectin. He sued Centera because he believes the drug can help kill the COVID virus. He is suing the healthcare system because they won't allow him to treat COVID-19 patients with ivermectin along with a host of other drugs that make up his developed math protocol. He's never actually prescribed ivermectin for COVID-19 patients, but his attorneys say he's relied on research and studies to come to the belief that it's safe in treating him. He is also...
Senator Chase, how many people do you have to speak that you're going to have to introduce? Because do you still restrict it to your 5 minutes?
Okay, I have two speakers, two main speakers, and then I have other people in support. So, all right. So we'll get started with Dr. Paul Merrick. Thank you.
For those in the Zoom room that would like to speak
Morning.
in favor of this bill electronically, please raise your hand now.
Sorry,
Thank you, Dr. Merrick.
I got lost. Thank you. My name is Dr. Paul Merrick. I'm board certified in critical care medicine, internal medicine, neurocritical care, and nutrition support. I publish over 500 peer-reviewed papers. So I'm going to talk about today off-label drugs. So up until 2 years ago, off-label drugs were FDA approved at the discretion of the clinician. Suddenly with COVID, off-label drugs has become a bad word. As we heard today, the hospital I work at first banned ivermectin and then banned 5 other FDA-approved drugs which I had been using off-label. This action on the hospital has resulted in the death of at least 250 people that I could have saved. And this is an absolute travesty that the federal government, state agencies, and hospitals are banning doctors doing what doctors do. Doctors treat patients based on their best clinical judgment, and we should not have state agencies and hospitals telling doctors how to practice medicine. So we're going to talk about ivermectin. This was approved in 1987 for use in humans. It's been dispensed 3.7 billion times to humans, not horses. This is not a cheap, repurposed, deworming horse medicine. This has been dispensed to over 3.7 billion people across this planet and has changed the face of parasitic diseases in this country. After penicillin, it is the second most important drug ever invented. It has broad-spectrum antiparasitic and antiviral activity. It is one of the safest medications on this planet.
Dr. Merritt, we have a total of 5 minutes
Yes.
for all of our speakers.
So I'm just going to move to the chase. 71 clinical trials. Remdesivir, which does not improve patient outcome, in fact, it increases the risk of death, was based on one erroneous study. There's 71 randomized controlled trials demonstrating the benefit of ivermectin. What I will then do is, it's safe in 79 countries, but apparently it's unsafe in the US. What I'll do is I will point to the VIGI Access database. So this is a database run by the WHO. They collect pharmacovigilance data for the last 25 years. If you look on this chart, you can see the number of so-called deaths from ivermectin over the last 25 years is 20, with 5,000 adverse effects. If you look at the COVID-19 vaccine, in 1 year, 14,000 deaths and over 2 million side effects. So it's completely hypocritical to say ivermectin is a dangerous horse deworming medicine when the vaccines are associated with 1,000 times the number of deaths and adverse effects.
So we need to give Dr. Fury a chance to speak too.
Okay, so that is just my introduction. This is a highly effective drug against SARS-CoV-2 and probably the safest medication on this planet.
Thank you. Thank you, Dr. Merrick. Dr. Fury.
You might just want to give us your name and tell us that you're in support, because with the number of people that I see standing.
I'm Dr. Sheila Fury. I'm a physician in the state of, and licensed in the state of Virginia. I've been in private practice for 21 years in the city of Richmond. I have been treating COVID-19. I have treated over 200 people successfully with ivermectin and the IMATH and the IMASK protocol that was developed by the FLCCC and Dr. Merrick. It is a travesty that the physicians in this city and in this country and then in the state are not allowed to practice and give this life-saving medication, that we are inhibited at every step of the road, that physicians in hospitals and in private practices are prohibited from giving this life-saving drug. The entire doctor-patient relationship has been shattered because we have chosen to bureaucracy and a set of rules rather than treating individual patients. I have gone into the homes and done home visits on families who have had every single member of their family with COVID.
Thank you very much. Your time is up. 5 minutes is up. Thank you very much.
All right.
Senator Chase, you want to wrap it up?
All right. So what I would like to tell you all is that there is more than one protocol for treating COVID-19 that is working.
Senator Chase, I'm sorry. I see several speakers
Yes.
in the Zoom room who would like to speak.
Yes.
Are there those in the Zoom room who, while we're dealing with the opposition, who would like to just state your name and indicate whether you are in support or not? And if you are not in support, we'd like for you to go on and start your 5 minutes. Senator Chase, and then I'll let you wrap it up.
Thank you.
Zoom room?
Wade Spravorior, I'm sorry, I pronounced you wrong terribly, but please unmute and begin your testimony now.
We can hear you.
All right. So you can hear me?
Yes. Are you speaking in favor or opposition?
In favor of. I'm just trying to find
I'm sorry, your time is up.
My time is up.
Yes, sir. I like those who are speaking in opposition. The 5 minutes was used by the first two speakers. Opposition, please.
Rob Schilling, please unmute and begin your testimony now.
Yeah, do you hear me?
We can hear you well.
Fine, thank you very much. It's time for medical freedom in Virginia. You need to allow doctors to do what they know how to do best and treat patients. Get government and the medical establishment.
They cut him off.
For those in the Zoom room, we are looking for people who are speaking in opposition only at this time. If you would like to speak in opposition, please raise your hand electronically now.
Talking about red.
Madam Chair, it does not seem we have anyone in opposition in the Zoom room at this time.
We're looking at the speakers in opposition, and I see Wade, Rick. On the other side, okay, those have gone away.
Madam Chair, they may have signed up incorrectly. They raised their hand at the wrong time.
Raise your hand at the wrong time. Senator Chase, please wrap it up.
Thank you, Madam Chairman. I would just like to thank the hundreds of people that are online that were not able to speak today in favor of the bill. I would also like to point out there was zero opposition to the bill. tons of people out in the hallway, people in here that could not come in. So I would like to recognize their presence today, and I appreciate the time constraints and the number of bills that you all have in the Senate Education Committee that you have to get through today. But I do not feel like this bill was adequately had the time to be heard today, but I appreciate and would say that I believe
Senator
that
Chase,
everybody
Senator Chase.
has the right to try the medication according to the law, and I would ask you all to support this bill. Thank you.
Senator Chase, I'd just like to correct one thing that you've said. You said that you didn't have adequate time to have your bill heard. We've given you the same time that we would give any other patron of a bill.
I'm sorry, let me correct myself. I do not believe that each of my speakers was given enough time. We have a number of speakers today that have come and traveled all the way from New Hampshire and from all across the country, experts to speak in favor of this bill, and I just wanted to give you all as much information as you could. We do have a handout for you that's been passed out to you that you can take a look at. Unfortunately, I wish we had more time to talk and educate the members who will be voting on this fine bill today to give more freedom to patients for the treatment of COVID, but I understand the time restrictions.
Thank you, Senator Chase. I will come now to the committee. Senator Newman.
Sides, our testimony, and it's bipartisan that we've kind of done that. I will say this, I understood that you had a broader bill, because my interest is on a broader item, right? Because, as you know, in a previous life, I spent a lot of time in the pharmaceutical industry, and we did off-label, and we did a lot of generic drugs, and very successfully. Is my understanding you have another bill that is broader, that goes to the broader issues without cherry-picking a couple of drugs, that says that we should go back to what has always been the case, at least that I knew of, and that is that you could use off-label drugs.
Right.
Is that correct? Is there another bill coming that is a broader in nature?
Thank you, Senator Newman. That is true. This bill, we specifically dealt with in a more narrow focus for hydroxychloroquine and ivermectin, because whenever you open it up to a broader perspective, sometimes it opens up a Pandora's box, and we just wanted to try multiple strategies with the bill. But, this bill, we wanted to specifically target COVID-19 and specifically ivermectin and hydroxychloroquine specifically, because those are the two drugs. And I have a number of court cases that were actually won, specifically as it relates to COVID-19 and hospitals denying patients the ability to be treated with ivermectin and hydroxychloroquine, and they won their lawsuits.
Thank you very much.
So that's why I narrowed the focus. Thank you.
Senator Newman? Other members of the committee?
Madam Chairman.
Senator Donovan?
Thank you, Madam Chairman. I'll just say, we have recently made medical marijuana available in Virginia.
Yes.
Because we believe that there are decisions that can be made between doctors and patients about the risk and the value of medications and how they're used. And I really don't think that the state should be obstructing those conversations.
Amen.
I think we have to be consistent. And, this is something that needs to be reviewed between a patient and a doctor, and that there should be no obstructions to prescribing these medications.
Thank you, Senator Donovan. And to respond to that, if I
Senator
could, please.
Chase.
Thank you, Madam Chairman. You're exactly right. In fact, ivermectin has been used worldwide since 1970s. It's been around forever as an anti-parasitic drug. And that's one of the points that I was going to make later in my case here. We have just legalized marijuana in Virginia. So
Back to the committee. Senator Peterson?
Thank you, Madam Chair. I guess my question is, and maybe I'm missing this, is this drug illegal now? I mean, why do we need to have a code section to make it legal to prescribe these drugs? I mean, who's prohibiting it? I'm missing kind of the middle point here.
Pharmacy Therapeutic Committee.
Okay, so in other words, the institutional.
I'm going to have one of my experts to
No,
come
ma'am.
up and
No, ma'am.
All right, well,
Your
to
testimony
answer
for
the
your-
question.
No,
I
ma'am.
appreciate that, but I'm
You
just-
will answer the question.
I'm just sort of talking, so I guess my question is, we have structures in place that for whatever reason haven't legalized this.
So the Board of Medicine has been putting up objections.
Okay.
disciplinary action against a licensed healthcare provider is taking place for prescribing, administering, or dispensing hydroxychloroquine. Pharmacists aren't even allowed to prescribe it for that particular purpose.
Senator Peterson? Okay, I don't see any other speakers in my queue.
Madam
Just
Chair.
make sure I don't miss anyone. Senator Newman?
Madam Chair, I think the issue is even broader than this. I think the issue of whether or not you can use off-label uses has just been there forever. And I'm confused like Senator Peterson is on why this changed, right? And so my motion is that we would roll this into Senator Chase's broader bill to deal with all of the drugs in this way. We should not be restricting physicians as we did 3 or 4 years ago, back when I was involved. It was never done. So mine would be to roll the bill into.
I have a substitute motion.
Second the motion first.
I have a substitute motion.
Okay, we'll hear the substitute motion. Senator Saslaw?
I move that Senate Bill 73 be passed by indefinitely.
It's been moved and probably second that the bill be PBI. All in favor of the substitute motion, please designate on the electronic voting board. Clerk, close the roll.
Ayes 9, no 6.
Ayes 9, no 6. The bill is passed by indefinitely.
All right. Thank you, Madam Chair.
The next bill is Senate Bill 84. Senator Stanley, for those of you who are here for Senate Bill 73, I would ask that you will very politely leave the room so that others might come in so that their bill can be heard. Thank you very much.
My husband is in the hospital right now.
I'm sorry, ma'am. This bill is passed by indefinitely. Could those of you who are here on that bill please leave the room?
This is too important of a topic. Virginians are dying. People across this nation are dying as a result of this man
Could you
not being
please
allowed
have
to
the
treat.
people who are here on 73 leave the room?
Senator Lucas, you will repay. You will pay for this one day, making a decision that we can't talk.
Do not understand this.
People are dying because Dr. Merritt could not treat his patients. I've had 3 friends who have died because the hospitals refused ivermectin. They're giving them
Senator Chase, could you
remdesivir.
please have your speakers leave the room?
They're giving them remdesivir because it's a bigger reimbursement. Think about that, folks. It's a big reimbursement.
Could you please
for
have the
remdesivir.
speakers on 73 leave the room?
Leave the room, please.
It's wrong.
Let's go, please.
Thank you. You'll pay for this one day. You really will. Read this book.
Can we exit the room, ma'am?
I will.
Thank you.
She can pay for it with the $300,000 the state of Virginia just gave her.
Let's go, please.
Who?
Thank you.
The chairman.
300,000 for what?
Senate Bill 84. Senate Bill 84, Senator Stanley.
You need to open your eyes, folks. People are dying because they can't get treated with ivermectin. Pharmacy and therapeutic committees across this nation are prohibiting it.
Because they don't want to get sued.
Senator Stanley is not in the room. We will go to Senate Bill 171, Senator Peake. But Senator Peake, hold on a second. We got a little stirred up here.
Yeah, Tommy's here. Where's
I want to go to the patrons who are not on the committee, so they have other work to be done. So I see did I see Senator Norman? Senator Norman, could you please come forward and have your bill heard, sir? I'm sorry, there's too much noise going on here for a second. Please, I just need a little quiet here so that I can hear from Senator Norman.
I apologize up front that I won't have the excitement you just endured, and I'll cut to the chase very quickly. I have
Senator Norman, you know me well. I thrive on excitement.
Senate bills. Yes, I do. Senate bill. Senate Bill 78 it came out of the subcommittee that I believe Senator Barker chaired, and it enjoyed the support of that. I have a 2-line amendments that I think will clarify some matters.
Oh, here it is. Yeah.
While she's passing those out, basically what this bill does, Madam Chairman and ladies and gentlemen of the committee, is it indicates that under driver education, that parents must participate in 90 minutes. The line amendments indicate that it is only the classroom portion of driver's education curriculum and does not pick up or infer or recite that it must be behind the wheel. And the Second Amendment indicates that the curriculum will include the dangers of distracted driving. This similar legislation has been in Planning District 8 for a number of years on it, and the reason for the introduction of the distracted driving primarily is due to cell phones, to be truthful with you, that we've addressed that issue, and that any of you drive up and down the interstate coming or going to Richmond, if you look to your left or right, invariably you'll see folks that are on that. I would say, Madam Chairman, to my knowledge, there is no opposition, that the trial lawyers are supportive
Yes, sir, I
of
do
it.
note that there is no opposition. Your bill was heard in
On
the,
it, so
in subcommittee.
it makes me a
Madam
little
Chair, I
scary
move the
that you
amendments
try.
be agreed to.
There's a motion that the amendments be agreed to. All in favor of agreeing to the amendments, please say aye. Aye. Those have the same right. Senator Norman, please go on.
Madam Chair, I move the bill be reported as amended.
Second.
I would like to say very briefly that this was brought to me by a constituent that is here, and Tammy and her husband have been here at the Irving meeting, Tammy Guido, and it's a result of the lack of this education and exposure that her son died in an accident by a vehicle driven by a young man who was not licensed. And
I think I
she's
saw
here.
them in the room
She's
earlier.
here.
Tommy,
Yes.
I have one question.
Senator Sasslaw.
Yeah, what is parent-student?
I'm sorry?
Parent/student. I mean, does that mean the parent has to be part of the driver education system? Is that what that is?
Oh, the parents, the parents and the student driver. Their kid,
Yeah.
the parent and their student driver. This is a driver education course. The student is in there.
Okay.
And I'm sorry to make it clear. Thank you, Doctor.
Madam Chair, I move the bill be reported as amended.
Second.
The moved and properly second that the bill be reported as amendment. All in favor, please designate on the voting board. Thank you, Senator Norman.
Thank you for your courtesies,
Ms.
and I
Clerk,
hope the
close
rest,
the roll.
I hope the rest of your morning is not as exciting.
Thank you, sir. I appreciate that.
Ayes 15, no zero.
Ayes 15, no zero. The bill is reported as amended. Thank you.
Thank you.
And I see Senator Stanley is here, so we're going to, is he here? We're going to hear from Senator Stanley, and then we're going to go back to our normal process, and we will hear from our subcommittee chairs. Senator Hanger? Okay, Senator Hanger, and then, okay, go ahead. No, Senator Stanley, you, and then Senator Hanger. Please go ahead, and then
Okay.
Senator McClellan. And your bills are in the subcommittee, so,
Good morning, Madam Chair.
good morning.
How's your day going? Never mind.
Very well.
Good. You are all the talk of the fifth and sixth floor right now. The secretaries were just all fluttered up about, I guess, something going on in here before I got here? Still? Excellent. So, good. So I'm going to bring a little joy to your hearts. And by joy, I mean so you can kill all my bills. And, Madam Chair, as Senate Bill 84 was before this committee last week, if you noted, if you recall, this bill is a 4-word addition to the Code Section 23.13113, the Empowerment Code Section for New College Institute in the glorious great city of Martinsville. Basically, this bill, as you heard before, allows, in its current form, allows NCI to collaborate with other training entities for workforce training when and only when the community college is unable or unwilling, but unable to fill that need And so New College could step in. What this does is, instead of collaboration, where we'd have to collaborate with another entity, this allows New College Institute to do it itself in those situations. If you do recall, the community colleges, Ellen Davenport voiced some concern about the bill. Senator Sasselaw, Madam Chair, said, why don't you guys go work it out and come back. Karen Jackson, who is our executive director, spoke with Ellen. From what Ellen represented, and Ellen cannot be here because she had a loss in the family. So Ellen and Ms. Jackson conversed, and they are both in agreement that this is a good bill, and in its current form needs no other changes. And there's no heat between us or our community college in Patrick and Henry. And in fact, we have reached out to them to make sure that we collaborate on this issue and even more issues. So the bill just allows, it is what it is, it's 4 words that allows when we have to do workforce training and it's not being offered at a community college, that New College can offer it itself if it doesn't collaborate with another institution that provides such workforce training.
If it does or doesn't?
Senator Sasselaw?
Did you say if it does, collaborates?
So, Madam Chair, Senator Sasselaw, if the community college does not offer this workforce training,
Right.
that would be the only time that we would then either collaborate with another entity or the corporation, or we'd offer it ourselves.
Madam Chair,
Senator Newman?
if this bill, I think, was heard last time and there is no longer any
It was.
opposition, I move that the bill be reported.
Okay.
Madam
Senator-
Chairman, it unfortunately has to go.
Senator Howell? It has to go to
Has
finance.
to go to finance.
And move to finance, what I meant.
Yes.
This bill will make money, not cost money, I assure you, Madam Chair.
It's been moved, and I did get a second, that the bill be reported and re-referred to finance. All in favor, please designate on the voting board. Thank you, Senator Stanley.
Ayes 15, no 0.
Thank you. Ayes 15, no 0. The bill is reported and re-referred to finance.
Thank you. I have one more bill, Madam Chair.
Senator Stanley.
Madam Chair, if you do recall, and we had this in a subcommittee, it's.
Well, I think we're gonna deal with that in September.
And if I can just, Madam Chair, if I could just say, we have the chair of the Commission on School Modernization, and I know the subcommittee will deal with an amendment to that. I think myself and the senator will work on this some more as it gets to the floor. I just want to bring to the attention of this committee one issue and one thing. I've been fighting with this in my head because what we want to do is have unspent funds where the school board can actually then use it for school modernization. The natural tension that exists between a board of supervisors and a school board is always there. And it is the board of supervisors that appropriates fund. My concern is that if the school board has, let's just say by using a number, $5 million sitting in excess, then the next year, my concern would be that the board of supervisors would cut their funding to make sure that they didn't have the excess. What we want is them to collaborate together so that we can modernize these schools, especially in rural areas and underserved areas and urban areas. We want them to take it upon themselves to use those
I
monies that
think
they
your bill
have.
is in good shape, and you know you can keep right on talking.
I'm getting the wrap it up signal from Senator Pearson, so that's all. I just want to make sure that we're trying to work through that. That's the tension and the issue, and I think we can work it out that way.
Thank you. Will the maker of the motion please understand that this bill has to be re-referred to finance? Can I get a motion? It's been moved and probably seconded that the bill be reported and re-referred to finance. All in favor, please vote on the electronic voting board.
And there is a substitute, I do believe.
Wait a minute, we didn't get the substitute.
It was substituted in committee, right?
Yeah.
I think this is.
Well, you were working on language, yeah.
It's part of the committee report, but what we were told to do was to
Madam Chair.
make sure we pass out the bills that were in the committee so that we could kind of clear out the room before we get to the subcommittee reports.
Madam
Senator
Chair.
Newman.
I move that a substitute motion that we report the substitute and then we can get to it.
Can I
Thank you,
move?
Senator Newman.
I think I need to move to reconsider our previous motion.
Sure.
Yeah.
I reconsider the motion by which we reported and referred to finance.
Thank you, Senator Peterson. Now, Senator Newman.
Yeah, we got to vote on that.
Okay. Thank you.
Ayes 15, no 0.
Thank you. Ayes 15, no 0.
And now I move that we adopt the substitute.
It's been moved and properly second that the substitute be adopted. All in favor of that motion, please designate on the electronic voting board.
Just say aye.
Just aye. That's it.
Aye.
It's a vote, okay, please say aye or nay. Thank you.
Now
Please
that
say aye.
we, now that we have the substitute in front of us, I move that we report and refer the substitute to finance.
It's been moved and properly second that the substitute be reported and re-referred to Senate Finance. All in favor of that motion, please vote in electronic voting board. Clerk, close the roll.
Ayes 15, no zero.
Ayes 15, no zero. The substitute is reported and will be re-referred to Senate Finance. Have a good day, Senator
Thank you
Sanders.
for listening to me, Madam Chair. It's always great to see you.
You as well. Senator Hanger, and then I see Senator McClellan will follow.
Thank you, Madam Chair and members of the committee. Senate Bill 100 deals with do not resuscitate orders, specifically in residential settings like group homes licensed by the Department of Behavioral Health Developmental Services. Senator Lewis's subcommittee heard this, and they recommended a substitute. So I would first ask you to adopt the substitute that Senator Lewis's subcommittee entertained.
Yeah, I'm not.
I'd like to offer the substitute.
There's a
Y'all
motion,
stand
there's a
on the
motion
oxygen
to
tank,
move the
too.
substitute. All in favor, please say aye.
Thank you, Madam Chair. This bill, as Senator Lewis would indicate in his report, there was no opposition, but Senator Donovan abstained on it because she wanted to wordsmith one line. So she has an amendment that I'm agreeable to that I would like for the group to entertain. And Senator Donovan, I don't know if you have it or you want me to, you've got the copy of it there?
Yes. Thank you, Senator Hanger, Madam Chairman. It's just really some changes in language in lines 13 to 17 to clarify. And the new language basically says, in the event of a cardiac and respiratory arrest, programs that are licensed by the department may direct program employees certified in CPR to comply with the program participants' valid written order not to resuscitate. And I'm sorry, the amendment should, the last, after if should be stricken. It's fine, just leave it. It's fine, it's absolutely fine. It's just a matter of making it clear that the programs were protected, and the language before was a little bit cumbersome. So this is, the substitute is before you, and I move the substitute.
Second.
Okay. Madam Chair, Senator Donovan basically was just wordsmithing a little bit there to make more clarity, and I agree with it.
Okay, I follow. And after Senator Hanger, I know that there are other patrons there in the audience, but we will have to move back to, yes, I see Senator Borsco and also see Senator McClellan, and both of their bills are in subcommittee reports and they've already been heard. We got off track after hydroxychloroquine and started hearing the other patrons, but your bills are in the subcommittee reports. So Senator Hanger, did I hear a motion?
Yes, move
Motion and a second.
to accept the substitute.
To accept the substitute. All in favor of that motion, please designate on the electronic. Say aye.
Move to report.
It's been moved and properly second that the bill be reported. All in favor, please designate electronically.
It's like the Wild West.
Clerk will close the roll.
Ayes 15, no zero.
Clerk will close the roll. I need 6 ears up here. The bill is reported. All in favor.
Thank you, Madam Chair, members of the committee. Appreciate the
Thank you,
courtesy.
Senator Hanger. Okay, since we're this far off course, let's hear the other 3 bills and then we'll go to the reports. I think Senator McClellan, I'm sorry, Senator McClellan, I did call on you first, but I think Senator Borsco was sitting there first. So Senator Borsco, Senator McClellan, Senator, yeah, but hers was heard in Senator.
You're up.
Borsco, McClellan, Favola.
Excellent. Can we start with SB 439, please, the higher ed hazing policies? I have 3 sets of amendments for this.
Okay, could I get a motion on them, on the amendments? Did I get a second?
Second.
It's been moved and properly second that the amendments be agreed to. All in favor, say aye. Noes have the same right. Senator Boyce.
Thank you so much, Madam Chair. In the Higher Education Subcommittee, the First Amendment corrects a drafting error, replacing sexual violence with hazing on line 67. Secondly, after discussions with stakeholders from the colleges, they were concerned about the immunity piece that would exclude persons who commit the hazing acts being subject to immunity. So on line 68, after made, insert by a bystander not involved with such act. And then on line 70, injury, after injury, insert or is likely to cause an injury. And on line 84, strike section A and insert subject to limitations in subsection B. And then I don't know, and Anna might be able to answer, if we need to completely strike section A on line 44 as the third amendment. Sorry. So this we just negotiated this with the colleges a couple of minutes ago. There is an interest in striking section A, this would be the third amendment, on line 44 through 53. And then just moving on so that the advisor is still required to go through training, that the students are still required to go through training. But there would be a little more flexibility for the schools to decide who the advisors would be. So those are the amendments.
Madam Chair,
Senator Peterson,
I'd like to move those amendments and speak to the motion.
I need a second. It's been moved and properly second.
Thank you. First of all, I want
Adopt those, Senator Peterson, let us adopt those first. All in favor, say aye.
Aye.
Ayes have it. Senator Peterson?
Okay. Well, I may already be moot at this point, but I just say we heard this in subcommittee and there's some heartrending stories, and I see the family there in the audience. And I want to thank Senator Boysko. I think there were some flexibility issues with student organizations, just making sure that we have the man and woman power just to cover this. So I supported these amendments. I think this is an excellent piece of legislation.
Thank you.
Other members of the committee? Senator Newman?
Madam Chair, maybe it's to Senator Peterson, maybe it's to the patron, but one of the concerns was the ability to get, and I forget the name of it, it's not proctors, but it's people who...
Advisors.
Yeah. I've heard a lot about that, and how did the amendments fix the advisor shortage we have today, which is extraordinary, with the increased duties?
Madam Chair, Senator Newman.
Senator Boysko.
That is exactly what the third amendment does. It eliminates that requirement that it not be a member of the organization. It gives some more flexibility back to the organizations to select them. So I've been meeting with members of our largest universities this morning, and we agreed that this would make the bill something that they could support with that language removed. And I've also spoken with the family, and they understand that as well. So I believe I have support from our largest universities, and they're here if you have any questions from them.
Madam Chair.
Senator Newman.
I apologize. I just, have you heard from the private colleges and universities as well, where I had heard the most concerns about the ability to have these individuals? Have you heard from them?
So let me just read to you what I've taken out of the bill to make it clear. This is struck from the language on line 43, advisors, new member events. So this is no longer in the bill. Each student organization with new members shall have an advisor present at all new member events. Such advisor shall not be a student or former member from the student organizations with new members, or if applicable, the national organization which student organizations and new members is affiliated. The student organization with new members may select an advisor who shall subsequently be approved by the institution prior to serving as an advisor, or the organization may request that the institution provides an advisor for such events. For new members, events that are ceremonial, ritual, and other events are only permitted to attend by the new members. If the members of the student organization, the advisor shall be present and on premise at all times, but at the request of the leadership of the organization, shall leave the room where the ceremonies, rituals, and other events only permitted to attend by new members and members are conducted. So that language has been removed. I believe that has
Thank you,
taken the
Senator Boyce.
concern
And Senator
from
Newman,
most of the
I'm gonna,
people.
even though this was heard in the subcommittee, Senator Locke was a trained advisor. And even though we've heard this and we don't normally hear testimony in these committees, Senator Locke, could I please hear from you?
Thank you, Madam Chair. I mentioned this in the subcommittee. I was an advisor to an organization at a private school. So, and I had to go through training, both as an advisor and through risk management because of the issues of hazing. And I'm happy to see this legislation. And so to prevent the kind of incidents that have occurred on university and college campuses. So, and I had to be a member of the organization in order to be the advisor to the organization. So I am happy to see this. And I think that it will go a long way in trying to prevent the kind of incidents that we have seen on the college campuses. And I had to educate the members of the organization about hazing and about risk management. And I also had to say to individuals who were interested in the organization that if you went to an event and you did not see me, that meant that you were in the wrong place. And that reporting incidents of hazing not only would not benefit you, it would also jeopardize your ability to become a member of the organization. So I think that this is very beneficial and will go a long way in preventing some of the things that have occurred.
Senator Boysko, and I think I might add to what Senator Locke said, 3 members of the Senate are members of Divine Nine, and 3 of us are in this room.
Yes, ma'am.
Madam Chair?
Senator Edwards.
Having represented several students involved in suing certain fraternities and universities, I think it's a daggone good bill because it happens a lot. People who are that age, honest to God, I had some clients of mine, I looked at them, they're 19. Why'd you do this? Oh, everybody else was doing it. I thought I had to. At that age, the judgment factors in the brain haven't been matured yet. And so they do this stupid stuff. But any adult, 29 or 30, whatever, would never do this kind of stuff. In terms of over drinking, running, it hurt their grades, hurt their health, it hurt their, it was a terrible thing, and I'm glad to see this bill. It's a good bill.
Thank you.
Other members of the committee. Senator Hashmi.
Thank you, Madam Chair. I just want to thank the patron for bringing this bill and working so hard to get reconciliation and agreement with all the parties, especially with our institutions of higher learning. This is just such a critical bill. Each year we see so many tragedies on our college campuses, and families send their loved ones, their children to colleges to be educated. They don't send them to be traumatized and hazed, and I hope we can put a final end to this practice across all of our colleges. Thank you, Senator Boysko, for bringing the bill.
Thank you.
Senator Boysko.
Madam Chair, so would you like me to further explain the bill, or do you feel that
I'd
we
like
have
it if
enough?
you wrap it up because we've
Okay.
gone farther into the weeds than I had intended to.
Thank you. I just would like to acknowledge that Eric Oakes, who is the father of Adam, and his niece Courtney White are here in the room with us, and they've
Could you
worked
please stand
so
up and
hard
say who
on
you are?
this.
Thank you so much for being here. Thank you.
Yeah. We've been working together for about 6 months, so I hope it is the pleasure of the body to pass the bill.
Madam
Can I
Chair.
get a motion? Senator Newman?
I don't want to slow the train down. I just had a number of concerns from some of the privates, and you probably have solved them all, but I'm going to abstain for now. But if you don't mind working with them to make sure the privates are all good between now and the floor.
Absolutely, and I think maybe just some conversations to let them know what we've done to change things would probably alleviate their concerns. And there are members of the universities, UVA, Radford, Virginia Tech, all here, all supporting the bill.
Please stand so that we can know who you are. Thank you very much for being here. Senator Boysko, you want to wrap it up?
Ma'am, yes, I think this is a very important bill. We know that there are some specific concrete things that we can do around education and reporting that could have changed the outcome for Adam Oaks. I hope that it is the will of the body to support this bill and move it onto the Senate floor.
We operate by motion.
Madam Chair, move the report as amended.
So it's been moved probably second that the bill be reported as amended. All in favor, please designate on the electronic voting board. Clerk will close the roll.
Ayes 14, no zeros.
Ayes 14.
Abstentions 1.
Ayes 14, no zero, abstention 1. The bill is reported with the amendments. Thank you, Senator Boysko.
Thank you. I have a second bill here, SB 454, the Teacher Training Corps.
Go right ahead.
Thank you, ma'am. This was heard in
It was in the
subcommittee.
I'm sorry, I just want to explain. Once we got on the track of having the bills heard after hydroxychloroquine, we kind of got off track. So since we only have 3 other speakers, we're just going to go ahead with those. But we've heard testimony in the subcommittee, so there will be no further testimony.
Yes, ma'am. I have an amendment in the nature of a substitute for this.
Amendment, please. Substitute has been moved and probably second. All in favor, please say aye. Aye. No, say right.
Thank you, Madam.
Senator Boysko.
Madam Chair, I had a number of, so this is a teacher training corps, which would be a cohort of 25 students at each school that would work together collaboratively, would receive full tuition and room and board and a supplement. In order to receive that, they would commit to working in a higher need public school after graduation, after receiving their teacher training certificates. I was contacted by a number of schools who said, we'd like to be in this too, because it was such a great idea. They felt so. The amendment just changes, giving the ability for the commission that we are creating, the ability to include other schools and help them to apply to be part of this cohort as well.
Thank you, Senator Boysko. I think if there was no opposition in the subcommittee, there was not, Senator Locke, so if I could please entertain a motion on this bill.
To go to finance.
Okay, if I could get a motion and have it referred to finance. Senator Locke has moved, and it's been seconded by Senator Newman that the bill be reported and re-referred to finance. All in favor, please. I'm sorry. Yes, it's going to finance. Yes. All in favor of that motion, please designate electronically. Clerk will close the roll.
Ayes 15, no zero.
Ayes 15, no zero. The bill is reported and re-referred to finance. That's reported with a substitute.
Yes,
Referred
ma'am.
to finance. That's
Thank
correct.
you.
Yes, okay. Senator McClellan, was there opposition to your bill?
I don't believe these were heard in subcommittee, or if they were, I wasn't there.
Okay. Go ahead, Senator McClellan.
All right, the first one is Senate Bill 471, which I understand is just being re-referred to finance.
Yes,
Okay. The second one is Senate Bill 479, which is a code commission bill to remove obsolete provisions in the health services section of the code. I can explain it more if you want, but that's all it does.
If we want to expedite the calendar, it's been moved and properly seconded the bill be reported. All in favor of that motion, please so designate electronically. Clerk will close the roll.
Ayes 15, no zero.
Ayes 15, no zero. The bill is reported. Thank you, Senator McClellan.
Thank you, Madam Chair.
Senator Favola.
Thank you, Madam Chair. I had two bills that were heard in different
Subcommittee?
subcommittees.
Was there opposition?
My medical licensure bill, there was no opposition. It passed out unanimously. Senator Barker
Could
was
we
the
get a
chair.
motion?
Madam Chair, we recommended reporting with a substitute for this bill, and on a 7-0 vote, so there's no opposition. So,
It's been moved and properly second that the substitute be agreed to. All in favor, please say aye.
aye. And with that, then I'll make a motion to report the bill as amended.
It's been moved and properly second that the bill be reported as amended. All in favor of that motion? I'm sorry, clerk, is there clarification?
1 second, Madam Chair.
Or amendments, yeah, okay.
He said that's amended.
Yeah.
I can tell you what the amendment was. It was a one-word amendment. In the bill, we talked about licensure of healthcare professionals. We used the word employed, and we added the word or contracted, and that was the only change in that bill. So it would apply for hospitals, dialysis facilities, and nursing homes. They could either employ a professional or contract with a professional who would be eligible for then an expedited licensure. They would be able to practice for 90 days. Within that time frame, they would apply to the Board of Health and get their license. If they didn't have the license within 90 days, it was another extension of 60 days. This, in effect, memorialized the emergency order that Governor Northam had put in place in June so we could help the hospitals who were, we just didn't have enough staff to deal with the incredible caseload we have resulting from COVID.
Thank you. I see Senator Peterson in queue.
Yeah, I was just trying to get at what this bill was about, and you may have just explained it, Barbara, that this is basically extending the time period for an out-of-state person to be licensed?
There's three parts to the bill. The first part was, again, to allow the hospitals, nursing homes, and dialysis facilities to hire right away out-of-state physicians, and then we had a time frame by which they'd be licensed. Second part of the bill had a reciprocal agreement. So states that were surrounding Virginia, if they entered a reciprocal agreement with Virginia, we would expedite that license within 20 days, 20 calendar days. The third part of the bill was an emergency enactment clause.
Got it. Thank you.
Senator Peterson?
That's it.
Okay, thank you.
Move to report.
Thank you.
It's been moved.
As amended.
Senator Barker, could you carry this?
Yes.
Didn't you make a motion?
We made a motion to report as amended the bill, so.
It's been moved and properly second that the bill be reported as amended. All in favor of that motion, please designate electronically. Clerk will close the roll.
Ayes 15, no zero.
Ayes 15, no zero. Senator Favola, the bill is reported with the amendments. Thank you.
Thank you, Madam Chair and members of the committee. I have a second bill before
Is it
you.
in the subcommittee?
It came from a subcommittee. It's Senate Bill 68.
Was there opposition?
There was one abstention, and it was from Senator Donovan, who had come to the meeting late and didn't hear the presentation.
But there was a motion that came from the subcommittee.
It was, and the
Okay.
motion was to approve.
We'll have that heard in the subcommittee.
It was already heard in subcommittee, and the
I mean,
subcommittee.
we'll have that heard here, but it'll be reported by the subcommittee chairs.
Okay, very good.
Thank you. Okay, I think we're now back on track.
Subcommittee Chair was Senator Hashmi. Is she going to present it now?
Her subcommittee report is up first, yes.
Okay, thank you. Then I'll wait.
Senator Hashmi. I want to hear from Senator Hashmi on public education. She is chair of that subcommittee. Senator Hashmi.
Well, thank you, Madam Chair, and Senator Favola is correct. It's SB 68 is the bill that was heard in subcommittee, and it reported with an amendment. It is a technical amendment, and you'll see that in your packet on the subcommittee report amendments. It is on line 155. It's simply introduced after teach, we are inserting issued by an entity. This particular bill, SB 68, is an attempt, again, to address our critical workforce shortage, primarily now in education, in our K-12 systems. This would allow individuals who have a license or certification from other nations to be able to teach within our systems, and they would go through the process of approval as reviewed by our professional boards, and then be able to engage in teaching in our classrooms. And this is a bill that's supported by teacher organizations and other organizations in an effort to ensure that we have quality teachers and are addressing our workforce shortages. It did pass out of committee. It was recommended for reporting with the amendment on a vote of 3 yes and 1 abstention, as Senator Favola pointed out. And I so move.
It's been moved, probably second, that Senate Bill 68. Was there an amendment? No? Be reported. All in favor of that motion? Please,
Madam Chair, I believe we have to move the amendment.
I move the amendment.
Okay. All in favor of moving the amendment, please designate by saying aye.
Aye.
Those opposed? Thank you so much. Okay, and now back to your motions.
No, I recommend reporting with the amendment.
It's been moved and properly second that the bill be reported as amended. All in favor of that motion, please designate electronically. Clerk, close the roll.
Ayes 14, no 0, abstentions 1.
Ayes 14, nays 0, and 1 abstention. The bill is reported.
Thank you, Madam
with the
Chair.
amendment. Thank you, Barbara. Thank you, Dr. Senator Favola. Getting a little tongue-tied here. Back to Senator Hodgman for your committee report.
Thank you, Madam Chair. SB 78, we have already heard and moved. And the next bill then is SB 154, and this is patroned by Senator Locke. Like Senator Favola's bill, this is again helping to address our critical workforce shortage, and this is an opportunity to expedite the ways in which our military spouses are can pass licensure exams and get credentialed in order to teach in our schools. If a military spouse is licensed in another state, they would be able to carry that into our Virginia schools. And this bill reported out of committee on a vote of 4-0, and I recommend that we, and I so move.
It's been moved and properly second that Senate Bill 154 be reported. All in favor of that motion, please designate electronically. Clerk will close the roll.
Ayes 15, no 0.
Ayes 15, no 0, the bill is reported. Senator Hodgman, are there other bills in your subcommittee?
Yes, Madam Chair. The final bill is SB 193, patroned by Senator Mason, and this seeks to address a problem that is created for our private schools. So if we can recall, last year we allowed child daycare services to be provided by our public schools for before school and after school care, but we did not include our private schools in that same process. And this is simply to ensure that accredited private schools that are in good standing by the Virginia Council of Private Education are able to provide before school, after school care for the children who attend that school. These are children who are going to be at least 5 years of age. They're enrolled in that school, and it simply extends the same standards that we gave to our public schools to our private schools. This bill reported out of committee on a vote of 3-0, and I so move.
Madam Chair.
Senator Newman.
Question for Senator Hashmi. I think it looks fine. My question is by the inclusion of these guys, is there anyone now that was included in the capability that are not included now? In other words, is there anything in here that knocks any of the private schools out?
Madam Chair and Senator, I believe those who would be excluded would be those who are not in good standing with the Virginia Council of Private Education.
Okay.
If they're non-accredited private schools.
Thank you, Madam Chair. I just don't know who those people are, but thank you.
Thank you.
This bill reported on a vote of 3-0, and I so move.
It's been moved and properly second that Senate Bill 193 be reported. All in favor of that motion, please designate electronically. Yeah, voting, Senator, you've been voted.
Ayes
by proxy.
15, no zero.
Ayes 15, no zero, the bill is reported. Thank you. Senator Hashmi.
Madam Chair, we have heard and voted on SB 276, and so this concludes my report.
Thank you so much, Senator Hashmi. Moving on to our Higher Education Subcommittee, Senator Locke.
Thank you, Madam Chair. I would like to take up two bills in a block because the request from the patrons is that these bills be stricken from the docket. And that is Senate Bill 420 from Senator Edwards and Senate Bill 611 from Senator Boysko. And I would move that they be stricken from the docket.
Okay, repeat those bills again, Senator Locke.
Madam Chair.
Senate Bill 420 and Senate Bill 611.
Okay.
Madam Chair, would you mind if we did those individually?
Do them individually?
Yes,
Okay.
ma'am, please.
Okay, Senate Bill 420 from Senator Edwards. The motion is to that it be stricken from the docket, and I so move.
I second that
It's
motion.
been moved and properly second that Senate Bill 420 be stricken from the docket, but at the request of the patron. All in favor, please vote electronically. Clerk, close the roll.
You have to take back your phone.
You can-
Ayes 15, no zero.
Ayes 15, no zero. The bill is stricken. Senator Locke.
The second bill is Senate Bill 611 from Senator Boysko, and at the request of the patron, I move that that bill be stricken from the docket.
You've heard the motion. And a second, that Senate Bill 611 be stricken from the docket. All in favor of that motion, please vote electronically. Clerk will close the roll.
Ayes 15, no zero.
Ayes 15, no zero, the bill is stricken. Senator Locke.
Okay, Senate Bill 256 from Senator Bell authorizes the Department of Military Affairs to utilize grant funding for active members of the Virginia National Guard who attend any public institution of higher education or accredited non-private institution of higher education, who will meet certain requirements, would be eligible under current law to recruit qualified applicants to serve in the National Guard. The bill states that there will be yearly funding for which recruitment shall be at the discretion of the Adjutant General and the Department of Military Affairs, and will not exceed $50,000 for fiscal year for this recruitment program. The recommendation coming from the subcommittee was on a vote of 4-0, and I move that this bill be reported.
Second.
It's been moved and properly second.
And re-referred to finance.
It's been moved and properly second that the bill be reported and re-referred to finance. All in favor of that motion, please so designate electronically. And the clerk will close the roll.
Ayes 15, no zero.
Ayes 15, no zero. The bill is reported and re-referred to Senate Finance. Senator Locke.
Okay, the last bill, because we heard both of Boysko's, is Senate Bill 597 coming from Senator Pillion. It eliminates, it's dealing with the Virginia Commission for the Arts and the Arts Fund. It eliminates the Virginia Arts Foundation and transfers those powers and the fund itself to the Virginia Commission for the Arts. The vote coming from the subcommittee was 4-0 to recommend reporting, and I move that we pass Senate Bill 597.
Just a second.
Second.
It's been moved and properly second that Senate Bill 597 be reported. All in favor of that motion, please vote electronically. Thank you. The clerk will close the roll.
Ayes 15, no zero.
Ayes 15, no zero. The bill is reported. Thank you.
And that concludes the report coming from the Higher Education Subcommittee.
Thank you so much, Senator Locke. Our next subcommittee report will be coming from Senator Barker, and that is from Health Professions. Senator Barker?
Yes, I have two bills that have not been dealt with this morning that were dealt with in the subcommittee. The first of these is Senate Bill 300 from patron by Senator Deeds. It deals with the location treatment sites for people with opiate addiction. We actually have sort of a very divided system right now. In the legislation, the code right now provides that these treatment centers should not be within half a mile of a licensed daycare center or a school, K-12 school. But there are large numbers of exemptions in terms of that. All of Northern Virginia, Hampton Roads, areas like that have been exempted from that requirement. What this would do, there have been some challenges in terms of getting treatment sites in some places around the Commonwealth, and there have also been situations where they take an effort to establish a treatment site, and then a school or a daycare center comes and locates in that area within half a mile, and then that has presented some major problems for some operators. The committee voted 6-1 to recommend reporting, and I so move.
It's been moved and properly second that, Senator Donovan.
Question.
And then
for the
Senator Peterson. Those are,
Chairman,
that's the way it
because
shows up in the queue.
I apologize, I wasn't at the meeting. There had been the discussion of a amendment that excluded Suboxone, but left this restriction for methadone clinics because we're trying to move away from methadone in general. Was that amendment offered in the committee?
No, that amendment was not offered in the subcommittee, so.
Okay, all right. I need to speak to the
Okay,
entities. Thank you.
Okay.
Madam Chair.
Senator Peterson.
I have a somewhat different question, and just as a little bit of context, we've had an issue in Fairfax County with treatment centers being located in residential neighborhoods and then being considered a group home such that they don't need a special use permit. And I actually have a case in front of the Virginia Supreme Court on that right now. My question is to staff, would anything in this bill cause a methadone clinic or an opioid treatment clinic to be considered a group home under 15.2-2291?
Madam Chair, Senator Peterson, I don't believe anything in this bill would do that. No.
Okay, so I will refrain from putting some type of enactment clause on this, but I want to sort of put that on people's radar screen that, okay, that's enough. Thanks.
Thank you, Senator Peterson. Senator Donovan, you're still in queue. Did you have another question?
Oh, no, I'm sorry, Madam Chairman.
Thank you. Back to Senator Barker.
I guess we're ready to vote on the bill as a.
Okay, I think we already had a motion and a second.
Yeah.
Okay, it's been moved and properly second that Senate Bill 300 be reported. All in favor, please designate electronically. Clerk will close the roll.
Ayes 13, noes 1, abstentions 1.
Ayes 13, noes 1, abstention 1. The bill is reported.
All right, next one and the last one from the subcommittee, since we already did Senator Favola's bill, is Senate Bill 369 from Senator Stewart. There is an amendment, or a couple of amendments on this bill that were worked out in subcommittee involving Senator Stewart and various parties, particularly the representatives of the Board of Medicine. So I would ask that we adopt those amendments.
Second. It's been moved and properly second that the amendments be adopted. All in favor, please say aye.
Aye.
Nay, same right. Thank you, Senator Barker.
Yes, what this does is it allows a physician who is in another state or the District of Columbia to be able to continue providing for a period of time care to an individual who lives in Virginia through telemedicine. The issue that Senator Stewart had talked about was people from his area, around the Fredericksburg area. Some of them go for treatment to places like Johns Hopkins in Maryland or other sites in Maryland. And after they've been treated at the hospital, they want to be able to have follow-up visits with their physician from that treatment, but don't want to have to drive all the way to Baltimore or wherever in Maryland that would be occurring there if it's not necessary. So that's what we have here, and initially the Board of Medicine raised opposition concerns about this, but they worked out the amendments that resolved that, so they're satisfied with it now. And it would be only for physicians who had already provided care to the individual. So it would be someone who'd already established a relationship with the patient.
Thank you, Senator Barker. You made the motion.
Yeah, I move that we report the bill with,
It's been moved and properly second.
as amended.
That the bill be reported as amended. All in favor of that motion, please designate electronically. Clerk will close the roll.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported with the amendments. Thank you. Senator Barker, does that conclude your subcommittee report?
Yes.
Madam Chair.
Oh, Senator Newman.
If I could just, I've got to run to another meeting, and I'm going to be gone for the rest of the meeting. I apologize. If you don't mind me just on one quick item.
Please,
I
go
know
ahead.
that your tremendous staff had invited Secretary Gudera and others to come today, and I just want you to know that they were very sorry that they were not able to come. They didn't get the notice until about 4:37 yesterday, and they apologize, but they want you and others to know that they will be here anytime, and so they look
Well, thank
forward to being. And so they just spoke very highly of you, but they look forward to being here bright and early or whenever Madam Chair says to come. So
How about next full committee meeting?
next full committee would be fantastic. I think Secretary Littell is on a plane right now too, so I apologize. So just wanted to let you know.
Thank you, Senator Newman. Okay, now we will move to our next subcommittee report on health, presented by Senator Lewis. Senator Lewis.
Thank you, Madam Chair. Madam Chair, the first bill we took up was Senate Bill 55, which is Senator Cosgrove's bill, and there was a substitute presented at subcommittee, and I would move the substitute.
It's been moved and properly second that the substitute be agreed to. All in favor, please say aye.
Aye.
Aye, okay, Senator.
Madam Chair, the Senate Bill 55 by Senator Cosgrove requires the state registrar to amend a certificate of death within 45 days. The original bill said 30, the substitute moved it to 45 days after the death upon receipt of an affidavit with supporting documentation as to the change on the death certificate. And the rest of the code section provides that, obviously, is existing law that the code section, that the death certificate is marked as an amended death certificate and then recites in there the basis for the amendment. There was no opposition before the committee, and it was the committee's recommendation that the bill as a substitute be recommended to be reported to the full committee by a vote of 4-0, and I so move.
You've heard the motion? In a second, that the bill be reported with a substitute. All in favor of that motion, please designate electronically. Thank you. Clerk, close the roll.
Ayes 15, no zero.
Ayes 15, no zero. The bill is reported with a substitute.
And we've already dealt with Senator Hanger's Senate Bill 100, Madam Chair, and then we went on to Senator Suderline's Senate Bill 231, and I understand Senator Suderline has an amendment to offer to the committee.
Thank you.
Senator Suderline?
Thank you, Madam Chair. I think council is distributing the 3 line items. No. Thank you. Madam Chair, as you look at it, you will see that each line item inserts Commonwealth Coordinated Care Plus. They would also be eligible under this legislation, and DMAS passed that would be included. That's completely agreeable to us. So if it would be the pleasure of the committee, I would move the amendment be adopted.
Second.
It's been moved and properly second that the amendments be agreed to. All in favor, please say aye.
Aye.
Ayes have it.
Would you like me to? Thank you, Madam Chair. So what this bill before you does is we currently have 3 separate funds that are available to these folks that have significant challenges, and they're each capped at $5,000. Now, a family
It has to go to finance.
Yep, that's correct. And so the family might find it more preferable to, instead of, using all $5,000 and leaving so much in the other funds, and it's actually using more, especially the technology assistive services. And so this bill just consolidates the 3 silos into one larger fund. it's the same $15,000 being provided. And I hope it will be the pleasure of the committee to report and advance the finance.
Senator Lewis, that was the motion coming out of your subcommittee.
Yes,
You've-
Madam Chair,
you've-
it was recommended to be reported 4-0.
You've heard this motion and the second that the bill be reported and referred to Senate Finance. All in favor of that motion, please so designate electronically. Clerk, close the roll.
Ayes 15, no zero.
Ayes 15, no zero. The bill is reported and will be referred with the amendments to Senate Finance. Senator Lewis?
Yes, Madam Chair. The next bill we took up was Senate Bill 241, Senator Hashmi's bill. This bill, Madam Chair, created the Renal Disease Council and Renal Disease Council Fund. The purpose of the council is to advise the governor and the General Assembly on the needs of individuals with renal disease, identifying challenges to these individuals, and funding research related to disease. And funding also supports persons who have renal disease in the Commonwealth, and to develop programs to educate medical professionals and the public about about renal disease. And it then creates the Renal Disease Council Fund. There was some discussion on this in the subcommittee, and the final vote was 3-2 to recommend reporting, and I so move.
It's been moved and properly second that needs to go to finance. Did you put that in your motion?
Yes, ma'am.
Okay.
Recommend that I move it be reported and re-referred to finance.
Thank you. Second. It's been moved and properly second that the bill be reported and re-referred to Senate Finance. All in favor, please designate electronically.
Ayes 10, noes 5.
Ayes 10, noes 5. The bill is reported and will be re-referred to Senate Finance.
And next, Madam Chair, we took up Senator Hashmi's Senate Bill 243, which was a bill, again, dealing with renal disease, and established a patient navigator network to assist those folks with renal disease with navigating through the health system. And it permits the Department of Health, that is, to contract with other entities to establish the network and provide services to qualified patients. We heard the presentation by Senator Hashmi, and there was a motion to report, but there was no second, so therefore it comes before the full committee with no recommendation from the subcommittee.
I'd like to hear from the committee.
What is this?
Sir,
243.
Senator Lewis?
What is it establishes the Renal Disease Patient Navigator Network. Navigators to help folks with renal disease deal with the disease and navigate through the
Madam
system.
Chair,
Senator Peterson?
I guess I have to ask the age-old question, why do we have to have this in the code as opposed to just doing it?
Madam Chair.
Senator Donovan?
I think that the issue in subcommittee is that of all services that are funded and paid for, Medicare covers dialysis and transplant extraordinarily efficiently. With nurse navigators, this is a fiscal impact of $40,000, which wouldn't even hire half a nurse navigator in an area where it's already incredibly well managed by Medicare. And so the point was that it was unlikely to be very effective, even if people are in rural areas. If they're in a program for dialysis or transplant, they are well managed. And so it was thought to be redundant and unlikely to be effective.
Okay.
Madam Chair, I have a question about that.
Senator Edwards?
Yeah, Medicare is for older people. If you're younger, would Medicare cover this? Say 40 years old or 35
Yes.
years old or something?
Yes, Madam Chair, for
I'm getting a yes from
diagnosis.
Senator Barker and Senator Donovan.
Go
Senator
ahead,
Donovan,
go
I
ahead.
recognize you, and then Senator Barker.
Thank you, Madam Chair, and Senator Edwards, yes. If you have a diagnosis of renal failure, you're covered by Medicare, as you are for other disabilities,
Automatically?
pretty much.
Senator Barker?
Yeah, actually 40 or 50 years ago, Medicare did this, and it was related to a member of Congress that was had renal disease, and they made it so that every person in the entire country who has this renal disease condition is taken care of by Medicare, regardless of age or anything else.
Interesting.
Huh. I didn't think that was the case.
Albeit very brief discussion, I'm not hearing a motion, so Senator Lewis, next bill.
All right, Madam Chair. This was Senator Hashmi's Senate Bill 260, and it was the patron asked that the bill be stricken, and I would so move.
It's been moved and properly second that the bill be stricken at the request of the patron. All in favor of that motion?
Madam Chair, I just want to be clear that I have the correct bill up.
260.
260. At the request of the patron, Senate Bill 260 has been requested to be stricken. All in favor of that motion, please vote electronically. Thank you.
Ayes 15, no zero.
And
Ayes 15, no zero. The bill is stricken at the request of the patron. Senator Lewis.
finally, Madam Chair, we took up Senate Bill 426, Senator Donovan's bill. There was an amendment, and I would so move the amendment.
You've heard the motion? And it's second that the amendment be agreed to. All in favor, please say aye.
Aye. And with that, Madam Chair, what the Senate Bill 426 did was direct the Board of DMAS Medical Assistance Services to amend the state plan for medical assistance services to provide for medical assistance for remote patient monitoring services via telemedicine. And this is yet another effort to extend care through telemedicine for folks who have experienced acute health condition and for whom the use of remote patient monitoring may prevent readmission to hospital or emergency departments, and for patient-initiated asynchronous consultations and provider-to-provider consultations. And it was presented by Senator Donovan, heard by the subcommittee, and it was the subcommittee's recommendation on a vote of 5-0 that the bill be recommended to reporting, and I so move.
With the, going to finance?
Madam Chair.
Senator Lewis, could you please include that it will go to finance?
A move that it be reported and re-referred to finance.
Thank you. And it's
Madam-
second by the finance chair. Senator
Madam Chair, it
Donovan.
needs to be reported as amended, and the amendment actually specifies that any asynchronous consultations happen only in the context of a pre-existing patient-physician relationship. And so, yes, I second. Thank you, Madam Chair.
Okay. You all have heard the motion that the bill be reported and be referred to Senate Finance with amendments. All in favor of that motion, please designate electronically. Clerk will close the roll.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported as amended and be referred to Finance.
And that completes my report, Madam Chair.
Thank you, Senator Lewis, and thank all of the members of the subcommittee. And I'm going back through the calendar to see what bills we have left. Patrons here, well, we have Senator Pillion has our, I'm sorry, Senator Peake. Yes, Senator Peake. Senator Peake.
Yeah, I believe.
Senate Bill 171.
171, and we
Yes.
have an amended bill that,
Could we move the amendment after it's distributed?
Madam Chair, we don't have that in writing, but I'm happy to read what the new bill will say. It'll say that the Department of Health and the Department of Environmental Quality shall develop a harmful algae bloom mitigation plan for Lake Anna through or in conjunction with a state institution of higher learning and other organizations as deemed necessary.
You've heard the reading of the amendment. All in favor of the amendment, please designate by saying aye or nay. Aye.
Aye.
Amendment has been adopted. Senator Peake.
Thank you, Madam Chair. This started back at Lake Anna in my district back in 2018. Harmful algae bloom. We've actually put some budget amendments in the past couple of years. Thank you, Madam Chair of Finance, to study this. And then now we're following up on the study to take some action. I think there's been algae bloom in the lake, which is different than what we've had in the salt water. So we amended this and referred it, referencing specifically Lake Anna instead of all lakes. And then we want to refer this, there's been some mention that Virginia Tech has a program that has been studying this already. So we've brought it up. I met with Department of Health yesterday and DEQ, because originally it was through Department of Health. We had requested some things they couldn't do, so we're trying to collaborate between DEQ and Department of Health. It's going to have to go to Finance. It's going to require some money to continue this, but this is a pretty serious issue. It's affecting all kinds of freshwater places, but we'd like to focus on Lake Anna right now. And of course, it's the people who live there. A lot of folks from Northern Virginia have retirement places there or come down to that lake for recreational purposes. So it really affects a lot of people across the Commonwealth. And I'd ask that we pass this along. It's going to go to Finance. We're going to have to put some money on this issue.
Thank you, Senator Peak. Senator Peterson? Oh, I don't see you in queue, I'm sorry.
He looked like he was going to ask me a question.
Members of the committee? We operate by motion? It's been moved and properly seconded that the bill be reported and re-referred to Senate Finance with a substitute. All in favor of that motion, please designate electronically.
Thank you, Madam Chair.
Thank you, Senator Peak. Clerk, close the roll.
Ayes 15, no zero.
Ayes 15, no zero. The bill is reported and will be re-referred to Senate Finance with a substitute. Looking through the agenda, I see only one more bill by one of the patrons who is on the committee. Senator Edwards, was your bill heard? Senate Bill 421.
Madam Chair, this is a recommendation of the Code Commission. One of the responsibilities of the Code Commission is to identify obsolete provisions of the code. And so we had a work group with the Department of Education and the the Library of Virginia, and we identified two that should be obsolete under the Education Title 22.1, dealing with early childhood education and elementary and secondary education, and the Library Title 42.1, dealing with public records and the library. Certain obsolete provisions, plus there's some technical provisions. And if you want further explanation, Julia Carlson is available, I understand, to explain it further. There's a recommendation of the Code Commission, and we spent a lot of time going through page by page to identify all of this. So there's nothing of substance that changes in the code.
It's been moved and properly seconded that the bill be reported. All in favor of that motion, please designate electronically. Clerk, close the roll.
Ayes 15, no zero.
Ayes 15, no zero. The bill is reported. And I'm going to ask the clerk, I think I have gone through the entire agenda, and I don't see any bills left on.
Madam Chair, if you
Yes.
don't mind, can we do that last vote again? I did not have the motion up.
I'm sorry.
No.
It has been moved and seconded that Senate Bill 421 be reported. All in favor, please designate electronically. Clerk, close the roll.
Ayes 15, no zero.
Ayes 15, no zero. The bill is reported. No further business coming before the committee unless
Madam
someone
Chair.
tells me otherwise. Yes, ma'am.
SB 638, Senator Locke's bill, she requested that that bill be stricken because she's carrying another bill that is identical, SB 456.
Okay, let's take that motion. It has been moved and properly seconded that Senate Bill 638, Patriot Senator Locke, be stricken. All in favor, please vote electronically. Clerk, close roll.
Ayes 15, no zero.
Ayes 15, no zero. Does that complete the docket? And I guess, I knew about Senator Locke 638, so thank you very much. So if there's no further business to come before us in Education and Health, the committee shall rise.